Back pain, particularly the low back pain, has plagued humanity for thousands of years. Descriptions of lumbago, which is low back pain, and sciatica, which is pain in the leg, are found in the Bible and in the writings of Hippocrates. It is estimated that today in the United States, 75 million people suffer from low back pain, and there are 7 million new victims each year. Of these 5 million are partially disabled, and 2 million are unable to work at all. 80% of people in the United States will suffer from the affliction sometime in their lives. The financial cost of low back pain is enormous. $5 billion will be spent in the United States this year on the diagnosis and treatment of low back pain. Another $10 billion will be spent on disability compensation lawsuits, workers' compensation. The cost for treatment of low back pain is higher than the cost for treatment of heart disease or the cost for traffic accidents. 93 million workdays will be lost. 93 million workdays will be lost annually in the United States due to low back pain. The incidence of low back pain increases faster than any of the other ailments of the human race. I research on a constant basis. I read 30 to 40 research articles a month on low back pain, neck pain, something to do with the disc. The reason for doing that is I want to be able to help my patients to the best of my ability. Now, with low back pain and neck pain, and obviously you have more low back pain than you do neck pain, these conditions, up till this point in time, had a very mediocre results at best with all the procedures that were being tried with the different doctors. Now, the different doctors being medical doctors, chiropractors, pain management, you name it, I know it. Now, what I want you to understand is this. You don't have to live with that pain that you have. There is a solution for you. And maybe it's not axial decompression, the work that I do. But axial decompression is the reason that I've spent the last 6 years of my life dedicating myself to finding out solutions for disc problems. Up until that point in time, I really had nothing to give to the patients who would come in to me who had herniated disc, bulging disc, degenerative disc, facet syndrome, stenosis, failed back surgery syndrome. Now think about what I just said for a second. Failed back surgery syndrome. There's so many of them that they had to give it a syndrome. Now, the reason for talking to you about that is to let you know that you don't have to do what everyone tells you to do. There are other options. And the other thing that I want you to understand with today, if you don't get nothing out of today of what this little snippet that I'm doing for you today is this. You don't have to live with that pain. Everything that I have read in the way of research, 90% of all the people who get these conditions, there is an answer for that person. The ones that they have the hardest time with are the 10%. And believe it or not, those are the 10% that I usually get into my office. The 10% are the people who have tried anti-inflammatories, muscle relaxers, pain pills. They've tried shots into the back, either epidurals, cortisones injections. They've tried physical therapy. They've tried chiropractic. They have tried even back surgery. All these things have failed these people, and they have absolutely no other solution but to live with the pain. The problem I have with that is I know that there's another solution, and that's what got me into doing the axial decompression. Now, the best that I can tell you to do is this. If you have a condition that I've talked about earlier in this little snippet about back pain, neck pain, the causes of it, and they'll tell you, research will tell you that 80% of all back pain or neck pain is caused by a disc problem, disc-related in some way or another. That's the reason I do what I do. But getting back to, there is a solution other than going the medical route or the chiropractic route or doing all these other things that haven't worked for you. What I would recommend for you is this. All I'm asking you to do is look. Go through the information I have on my website, and it is extensive. There are 50 questions and answers on there of anything that you would ever want to know about the back. What's a disc? What is failed back pain or failed back surgery? What is microdiscectomy? What is a herniated disc? What is a bulging disc? What are epidural shots? What medications would they give to me? What would the medications do for me? I've answered all those questions for you in the web. So if you have a question, go to that. Now, the other thing that I would tell you is this. If all the things that I have written, everything that I have done for you doesn't answer your questions, email me. Shoot me an email at www.wilkinsspinalcare.com, and I'll get you an email back as fast as I possibly can. Now, the thing that I want to get across to you today is this. All these things that I gave to you in the way of facts and figures are all multiplied from what they were in their original 1990 statistics. I want you to know that you're not alone. I also want you to know that you don't have to continue to suffer like that, unless that's what you want to do. And most of my patients don't want to do that. They want a solution for their problem. That's why I put these things together for you so that you can look at it and you can take a look at it. The other thing that I have done for you is I did a seminar on the web so that you can actually just go and see what I do. And it's on the website that you're looking at right now. So take a look at that too. But what I wanted you to get is this. If you're having those type of problems, the best thing that I can tell you is to call our office and say, hey, I'd like to have Dr. Wilkins take a look at me. I'd like him to do an examination with me. I'd like him to see if he could actually help me. Now, my promise to every patient has been the same for 36 years, and that promise is this. If I do my physical examination with you and I can help you, I'll let you know that day. And if I do my physical exam and I can't help you, I'm going to get you to somebody who can help you so that you don't have to suffer. I see too much suffering in the work that I do. I would like to help as many people as I possibly can. So give us a call. Say, hey, Larry, let's take a look at me and see if you can help me. And if I can help you, I'll let you know that. And if I can't help you, I'm going to let you know that too. And that's kind of the reason that I did this little snippet. But the other reason was these facts and figures are alarming. Now, one thing that I'm going to let you with, and that's this. The medical profession is starting to speak out about two different things. The two things that they're speaking out about is back surgery. And I read a scathing report on this, and this is a quote from a medical doctor. And this quote goes like this, and I have the quote and I have the resource if you want it, so it's not me talking off the top of my head. The quote goes like this: low back pain surgery has created more human carnage than any surgery on the planet. Now, that's a medical doctor saying that. So I understand the problems that everybody has. I also understand why all these other things don't seem to help the people. And I understand because I see it day in and day out. All those things that I talk to you about, the medications, physical therapy, the epidurals, the surgeries. Most of my patients have had all those things and they have failed them. That's the reason that I wanted to get to you today and say, hey, look, you really don't have to continue to suffer with that. What I would urge you to do is give our office a call and say, hey, I want Dr. Wilkins to check me over. I want him to see what he can do to help me, see if he can help me, see if there is any help for me, instead of you living with the pain, all right? So that's what I would like to leave you with. The other thing is this. All the research that I have done, and it's extensive, not many people end up having to live with the pain unless it's actually what they choose to do. So you have a fantastic day. Go to those different things that I've talked to you about on the web. Go to the 50 questions. If you have a particular question, look it up. Get the answer for yourself. The other thing is this. Watch the video on the seminar. Get that. See what I do. Or come to one of our live seminars. It'll tell you on the web when our next seminar is in our office. And it's free. You can come in, sit down, and ask me any question that you want to. And I'll be more than glad to answer them. I'm one of the few doctors who don't mind questions. I actually kind of like the questions. Telephone number is 724-547-3377.